Hello everyone, welcome to Yashoda Hospital's online segment, the Health Talk session. Do you also sometimes wonder why so many people are getting diagnosed with cancer despite science having made a considerable advancements in the field of oncology? What are the measures one can take to prevent cancer? What are the symptoms one should look out when suspecting cancer? So let's discuss all these issues in our today's episode. I'm Dr. Lakshmi and let's welcome Senior Consultant Surgical Oncologist from Yashoda Hospital's Somajiguda. Welcome, Doctor.
Hello, happy morning and happy day to all of you and Dr. Lakshmi. Thanks for having this opportunity to discuss something about cancer related issues in our day-to-day life.
So, Doctor, tell us more about yourself and your journey in this medical field.
First of all, I'm Dr. Sachin. I'm a senior surgical oncologist, cancer specialist at Yashoda Hospital, Somajiguda. After doing my MS surgery, I passed out as a gold medalist from Mumbai University, and then I decided to become oncologist. I did my MCH surgical oncology. Then I did a few fellowships for robotic surgery, laparoscopic surgery, minimal invasive surgery from India, from Singapore, from London, UK. And then in last 12 years, I am in Yashoda Hospital, Somajiguda.
So, sir, what made you become an oncologist? Was it by a choice or by accident?
To be frank, doctor, it was both. It was by choice also and by accident also. There is something called as serendipity. You wanted to do and you get the right opportunities and you become the one person you want to become. Since childhood, I had some inclination to become doctor because I have family history. My many relatives, my own brother is doctor. When I was a kid in my childhood, I used to, open, we had a scooter, small Bajaj scooter, and I used to open and I used to do servicing. I used to see how the machines works, and probably that has helped me to open, our body and fix the organs where it has to be and clean it, and probably all these have came together, and that's how my journey started to become a cancer specialist.
So, doctor, the word cancer is associated with so much negativity and stigma around this. But now people are open and are talking freely about this. How do you think this has evolved?
Yes, doctor. There is a lot of stigma and negativity around cancer. Anybody in our close proximity got detected that he has or she has been cancer, immediately our antennas will be out, and there are a lot of questions in our minds that how it would be, whether I'll survive, what would be my treatment plan, and there are so many complications associated with financially also. I always feel that it is not the patient suffers in the cancer, but the whole family, the whole loved ones around him, they suffer. They also have to go to the same long journey. But I am fortunate that if you can wipe out few tears in the world, I think nothing like that. I always feel that to give life is God's work, to maintain that life is man's work, and if some damage happen in the body or in the life of that person, to repair it is our work, is a doctor's work. Of course, there is a negativity around it, a word, but from that negativity, if something has to come, I think that is positivity, positive outlook, and giving life to the patients and helping them to come out in their life, touching their life, saving many lives. That gives me immense joy and fulfillment.
So, sir, nowadays we see the cancer cases increasing daily. So, what do you think the reason for this could be?
See, our life expectancy is increasing. When India got freedom in 1947, that time the life expectancy was around 36 to 40 years, and now it is 65 to 70 years. So as age increases, the chances of having or risk of having cancer increases. The other reason I feel that our lifestyle, westernized lifestyle or sedentary lifestyle, and absolutely no physical work, no physical activity or exercise, then improper diet, the pesticides and chemicals which we are now using more and more, the pollution that is happening all around the world, that is also again important cause of cancer. And then also other causes which are preventable, like addictions. Now almost 60 to 70% of people, they have some kind of addiction. Probably it could be gutka, smoking, or alcohol, or drugs, or so many addictions are there, and that is also one of the important cause for oral cancer, lung cancer, and other cancers. Apart from that, other risk factor is hereditary. Few cancers, they run in the family. We call them as familial cancer or hereditary cancers.
Absolutely, sir. I think that's rightly said that unhealthy food habits and sedentary lifestyle is the root cause for not just cancer but many other diseases as well. So we all know that medical field is rapidly progressing. So what are the latest technological advancements in the field of cancer?
Medical field, especially the cancer field, is also growing very, very fast, and there are many more modalities which are there to reduce the side effects of the cancer treatment, and also they are for very accurate and precise cancer treatment. For example, now we have a PET scan, positron emission tomography scan, which is small. We inject some medicine and it gives all idea about the body wherever the cancer, even 1 millimeter tumor also can be detected with the PET scan, and also it can stage the disease accurately. It is only at one place or it has gone to some other place, that can be detected. Then we have a state of art molecular biology, genetic labs. We can all detect the which gene is faulty and how to repair it. All those things are available. Then as I told you, instead of normal conventional surgeries, now we are moving towards the high-end laparoscopic surgeries, thoracoscopic surgeries, minimally invasive surgeries, and robotic surgeries. Same way in the medical oncology, conventional chemotherapy has a lot of side effects and complications, but now we are evolving towards the targeted therapy, immunotherapy, which are very specific molecules which will only kill the cancer cells, bearing the side effects on the normal body. And same case true with the radiation. Normal radiation will have a lot of other side effects, lot of collateral damage, but now with the invention of IMRT, IGRT, or stereotactic surgery or cyberknife technology, the tumor can be killed with very precise, like a laser, with the radiation treatment without collateral damage.
So we all know that prevention is better than cure. So what are the ways that one can prevent from getting cancer?
Yes, absolutely. A stitch in time saves nine. Like moving from the unhealthy lifestyles, having balanced diet, avoiding junk food, and also having some physical activity every day. Science says that minimum 20 minutes physical activity has to be done every day. At the same time, a regular screening, like a screening mammography for breast cancer. Every female more than 40 years of age should undergo screening mammography. Second, like a pap smear for uterine cancer, or maybe a blood test like tumor markers CA125 or PSA for prostate cancer, or CEA like colonic cancer. These are some tumor marker cells which we can regularly do. It will save life, it will save money, it will save time. So prevention is always better than cure.
So we all know that you're a great surgeon, but not many know that you're a great author as well. So I'm unstoppable. What's your journey behind this?
Oh, that's lovely question. Yes, recently we have launched a book, I Am Unstoppable. See, any patient who come to OPD, they have a lot of doubts about cancers, like how it will be, what are the alternative modalities of the treatment, cancer treatment, or how to prevent cancer, and as a family, how can we help, and there are so many other things. So I just wanted to come up with a book so that will be unique book for people or society to having medical associated knowledge about cancer. But having said that, I also realized that there is so much negativity around cancer. So I thought, why can't we write inspirational stories, motivational stories of the patients which we have treated in our own hospital, Yashoda Hospital. And I selected a few stories and I told the patients to write their own language with their own emotions, and how they have gone through the long journey, what were the challenges and what helped you to do, what not to do, in a simple layman language. And very important is emotional well-being during cancer. So that is like how to bounce back, what is the role of hope, the family support, the laughter, the fun, all those things I have discussed in detail in that book.
Undoubtedly, that's one of the best books what one can read about cancer. So, doctor, apart from writing, what are the other things you enjoy in your free time?
That is a very good question. Yeah, we all know that being a doctor and being in this very tough, challenging field of cancer treatment, definitely we undergo a lot of stress. To manage that stress, there are so many things I do. I am an avid reader. I read a lot. Then I am a music lover. I don't sing or play any instrument, but I listen good music, soulful songs and instrumental music. My day start at 5:30 in the morning. Around 1 hour every day I give for myself. I get up and I do my exercise, yoga, jogging, meditation. I have a pet. His name is Neo, Neo. He's a Beagle dog, and it is the great stress buster for me. Whenever I go home, that fellow will come with the wagging of his tail and he will lick me as like he has not seen me for ages, and I cuddle him, and that is the greatest stress buster for me. Then as a family we play pranks. I have a son who is in 10th boards now. My wife is a radiologist, Dr Sapna. She is in Yashoda Hospital, Secunderabad branch. We go around. I am a nature lover. I try to see at least one trip in a month somewhere close to the nature where I am alone with myself. Those things help me. And also I do my spiritual retreat, or I can say something. I am alone with myself. I'm disconnected with the world cannot contact me, I cannot contact anybody. Off the technology, no mobile, no TV, no mirror, no speech. I think that gives me a lot of inner energy, and lot of introspection goes in, so where we are and what we need to do. And all those things, the family, the pet, my friends, my colleagues, music, reading, all these are greatest stress buster or blessing in my life.
Looks like you're a perfect human being, sir, with so much balance in your life. So that's amazing and inspiring journey. So before ending this episode, having a decade rich of experience in this medical field, what message you would like to give to the society as a healthcare oncologist specialist?
Yeah, I'll just say some correction. You told that you are the perfect human being, but I will add something. Yes, we are all human beings, but we have to become human. From human being to becoming more human. So emotionally, I always say that now robots are there, machineries are there, artificial intelligence is there, digital intelligence is there, but somehow our emotional there are a lot of emotional stress. There's a lot of emotional turmoil in every situation. So I think let us practice some empathy, some compassion with our fellow brothers, fellow relatives, fellow human being. And I think from human being to becoming human, I think that would be more. I think we all can strive for it. There are few tips I would like to give to the society or for all of us. Yes, that prevention is always better than cure. So let us try some preventive strategies as we have already discussed. Our body is our address, correct? It is not my home where I stay in Jubilee Hills or Banjara Hills or in Begumpet. Our body is our address. So we have to make our body very nice, clean, and away from any diseases. And also second part is be aware that we all go into our health is always the least priority for all of us. Always we are behind profession, money and all other things, but when it comes to health, it is always we are on back foot. I'll say some analogy for that. We all have gone through the flights, we have all traveled by air, correct? There that air hostess says very beautiful thing. I don't know whether you have noticed or not. She says that before assisting others, secure yourself. That means we all are worried about our parents' health or our brother's health or our friends' health, but we always neglect our own health. So let us try to secure ourselves. First ourselves be healthy so that we will able to help others. Regular screening, as I already told you, medical checkups, they will help us. Don't neglect the cancer symptoms or any other doubtful symptoms. Immediately seek medical help. And I would say as a community, now this is February is a World Cancer Awareness Month, and the theme for this month, this year is close the gap. We all want to help to the society in some or other way. So I will tell 3 T's by which we can help, either with our talent or with our time or with our treasure. Treasure means money. Whatever field we have, knowledge, we can share to the society, and that's the way to build this beautiful world, happy world and much more healthy world. So thank you very much, Team Yashoda, administration, Dr. Lakshmi, and all of you to bringing up this wonderful episode. And I feel that with this half an hour whatever discussion we had, if 1 or 2 insights, 1 or 2 points also we can implement, let it be I will practice healthy diet, I will do some exercise, I will take care of my family, I will take care of my body first, I will do stress man, any one thing you can pick up and you follow it rest of your life, I think the purpose of today's episode would be served.
Thank you, sir. It was wonderful talking to you, and I think I personally learned a lot from this.
Thank you very much, all of you, and happy life, healthy life, and blessed life.
So this brings us to the end of this episode. Thank you all for watching us, and do join us for the next week as well. Stay safe and take care.